Hi, my name is Summer, and I'm going to be describing the electrical conduction system of the heart as well as the blood flow through the heart. I'm going to start with the electrical conduction system, and we're going to start right here in the right atrium. This node right here is the SA node. It's also known as the pacemaker because it's the first impulse and it causes that atrial kick. It's going to travel to this second node under here, which is located on the interatrial septum. That is the AV node. That's the second impulse, which is going to send those impulses to the middle here, which is the bundle of His, which branches off into the right and left. The left is going to then branch off again into anterior and posterior. After these branch, the ending fibers at the very end, which are in the myocardium, are going to be the Purkinje fibers. They cause the ventricles to contract. So that's the electrical conduction system. Next, I'm going to talk about the blood circulation throughout the heart. We're going to start with blood coming in by way of the IVC and the SVC. Blood from the superior portions of the body are going to come through the SVC, while inferior blood is going to come through the IVC, which are both going to dump into this right atrium. The blood will then be pushed through these purple tricuspid valves, or tricuspid cusp, I should say. There's anterior, posterior, and medial. The blood's going to be pushed through there into this right ventricle. Also in the right ventricle here, we're going to see the moderator band, which just courses through the right ventricle. When the blood gets to the right ventricle, the ventricle is going to contract, sending the blood through the three pulmonic cusps. There's right, anterior, left. Then the blood's going to go through this pulmonic trunk. It'll then break off into the left pulmonary artery and the right pulmonary artery, which is going to go into the lungs. And after blood going through the lungs and being oxygenated, it's going to come back through these orange pulmonary veins. We're going to have the right upper, the right lower, left upper, left lower pulmonary vein. All these veins are going to empty into this left atrium here. The blood will then be pushed through the mitral valve, which has anterior, posterior leaflets, into the left ventricle here. The ventricle will then contract, pushing this blood through the three pink aortic leaflets here. There is the right, the non-coronary, which is also posterior, and then the left cusp. It's going to go through the red ascending aorta to the aortic arch. Some of the blood is going to distribute up to the superior portions of the body by way of the brachiocephalic artery, the left common carotid artery, and then the left subclavian artery. And what blood does not go up to the superior portions of the body will then continue through that aortic arch into the descending aorta, which courses posteriorly to the heart and would come past it all the way down to the abdomen, which is going to distribute that oxygenated blood to the rest of the body.